True and false. The external carotid artery terminates at the level of the The tongue consists of lymphoid tissue. The lingual tonsils are two small mounds of lymphatic tissue located in lamina propria of the root of the tongue. Intrinsic muscles of the tongue are not attached to bones. Thyroid gland is related to the carotid sheath. Thyroid gland overlies the second to fourth tracheal rings at the isthmus. The follicles are lined by the thyroid gland. Follicles are lined by the cuboidal epithelium. Thyroid gland develops as a proliferation of cells from the caudal end of the thyroglosal gland. During thyroidectomy, the external laryngeal nerve may get damaged. Regarding the mandible, mandible is formed around the buccal cartilage. Mandible is lined by mucosal membrane above the malhide line. In children, the mental foramen is closer to the lower border. This influences the direction in which needle is advanced for a mental nerve block. Inferior alveolar vessels and nerves enter the mandibular canal. The facial artery can be palpated on the lower border of the mandible at the entry border of the masseter. Regarding the eye and orbit, inferior orbital fissure is bound by the greater wing of the sphenoid and maxilla. The lacrimal bone forms the medial wall. Entry and posterior chambers communicate directly. Chambers communicate through pelvic. In the nasal cavity, posterior ethmoidal cells drain into the superior meatus. Sphenoethmoidal recess is lined by respiratory mucous membrane. Entire nasal cavity is lined by respiratory epithelium with the exception of the roof and the adjacent parts of the medial and lateral wall, which are lined by olfactory epithelium. The nasal cavity is mainly supplied by the maxillary artery. The main artery of the nasal cavity is the sphenopalatine artery, branch of the maxillary artery. Regarding the larynx, it is opposite the C4, C6. Laryngeal inlet is formed by the aryepiglottic muscle. Cricothyroid muscle is supplied by the external branch of superior laryngeal nerve. All intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve except for cricothyroid, which is innervated by external laryngeal nerve. Posterior cricoid is an abductor of the vocal cords. It is the most important muscle of the larynx as it is the sole abductor of the vocal folds responsible for opening the glottis. Submandibular gland lies below the digastric. Submandibular gland lies above the digastric in the submandibular digastric triangle. Submandibular gland, the deep part of the gland, extends forwards for a variable distance between malhide and hypoglossus below the lingual nerve and above the hypoglossal nerve. Submandibular gland is related to the hypoglossal nerve. Facial nerve hooks around the submandibular gland. Regarding the stapedius, it is a second-order derivative. Stapedius communicates with the nasopharynx by Eustachian tube. All the joints of the stapedius, regarding the stapedius, all the joints of ossicles are synovial. In the cavernous sinus, abducens nerve, it passes through the cavernous sinus inferolateral to the internal carotid artery. Ophthalmic and maxillary branches lie on the lateral wall of the cavernous sinus. In the cavernous sinus, communicate with the pterygoid plexus. In the cavernous sinus, drains via the petrosal sinus, both superior and inferior petrosal sinus. Structure found in the posterior triangle accessory nerve. Regarding the radiological investigation in the head and neck region to diagnose the condition in the cervical spinal cord, MRI is a superior CD scan. Fracture of the base of the skull cannot be ruled out but can be used to diagnose by an X-ray of the base of the skull. In the spinal cord, fascicular gracilis is medial to fasciculus cuneatus. Posterior spinocerebellar tracts most don't accusate, but anterior one does. Anterior spinal artery thrombosis spares the dorsal column. In the spinal cord, complex Brown-Séquard hemisection of the spinal cord causes Brown-Séquard syndrome. Cerebral lesion causes hypotonia, nystagmus, pendulis, knee-jerk, adidokinesia, intentional tremor. A fracture of the cubriform plate in the floor of the anterior cranial fossa may cause anosmia, CSF rhinorrhea. Which of the following tissues are derived from the neural crest cells? Skin melanocyte, dorsal root ganglion, parasympathetic ganglion, skull bones, and the face. Um, Adrenal cortex is a derivative of intermediate mesoderm. Which of the following are correctly matched with their origin? Thymus, third pouch, parathyroid, third and fourth pouch, renal capsule, metanephros, medulla of supranuclear neural crest cells. Nasal septum is formed by the vomer. Respiratory epithelium except the upper part which is lined by olfactory epithelium. Nasal septum contains anastomosis between the superior labial artery and sphenopalatine artery. Nasal septum contribute to form the caesal back plexus in little area, low anterior part of the nasal septum. Septal cartilage is hyaline. Nasal septum is situated in the midline, frequently deviated from the midline. However, it can be in the midline. Therefore, true. In the maxillary sinus is pyramidal in shape, roofed by the intraorbital plate. Maxillary sinus at a lower level than the hard palate in adult. Maxillary sinus side is posterior wall lying anteriorly to the pterygopalatine fossa. Maxillary sinus has its ostium open into the middle meatus at the into the posterior part of the hiatus. Semimoid is in the middle meatus. Regarding the vertebral column has four distinct curvatures, two primary and two secondary curvatures. 1/4 of the length of the vertebral column is formed by the intervertebral disc. Herniation of intervertebral disc causes compression of the spinal root. Facet joints are synovial joint. Regarding basal ganglia, putamen is derived from the neostriatum, caudate and putamen, neostriatum, globus pallidus, paleostriatum, amygdala, archaeostriatum. Subthalamic nucleus is a part of this complex, basal ganglia. Substantia nigra receives afferents from the striatum. Dysfunction shows the Huntington chorea. Following structure in the pterygomaxillary area stimulate tearing. Lacrimal nerve, nervus intermedius. Components of the pupillary light reflex. Lateral geniculate body goes through the pretectal. Following produce closure of the rima glottis. Lateral cricoarytenoid, oblique arytenoid, transverse arytenoid, sole posterior cricoarytenoid, sole abductor, therefore opens the rima glottis. Thyroarytenoid relaxes and hence shorten the vocal cords. The following structure passes through the cavernous sinus: internal carotid artery, oculomotor nerve, trochlear nerve, maxillary nerve. Internal carotid artery and auditionous nerve goes inside while oculomotor, trochlear and maxillary nerves runs in the lateral wall. Regarding the spinal cord, blood supplies by one anterior and two posterior spinal arteries. Motor decussation occurs lower medulla, sensory upper medulla. Regarding spinal cord, pyramidal ducts and the lateral white column. Regarding the spinal cord, pain is transmitted by lateral spinothalamic tract. Regarding spinal cord, lateral spinothalamic tract transmitted by dorsal column. Regarding the face and scalp, scalp contains numerous sebaceous glands. Facial artery pulsation can be felt on the mandibular process. The facial nerve is involved in the movement of all the facial muscle. All infection of the face may easily spread to the brain. Pulse of the superficial temporal artery is palpable on the zygomatic process. Regarding the thyroid gland, isthmus is at the level of the second to fourth tracheal rings. The superior thyroid artery is ligated close to the gland. Regarding the orbit and eye, lacrimal bone form the medial wall. Aqueous humor circulate from the posterior chamber to the anterior chamber of the eye. Cones are concentrated in fovea centralis. Regarding orbit and eye, when detaching the retina, the pigmented epithelium detaches from the choroid. In the detachment of the retina, the pigment cells remain in position while the rods and cones with the other layers of the retina become displaced inward from them. Regarding the nose and paranasal sinus, bulla ethmoid is formed by the middle ethmoid air cells. Sphenopalatine artery can be accessed posterior to the middle meatus. Sphenoidal sinus is innervated by posterior ethmoidal nerve. Regarding the larynx, the subglottis is mainly formed by the cricoid cartilage. Regarding larynx, malignancies is in the piriform fossa can cause referred pain in the ear. Each bronchopulmonary segment is supplied by its own artery. Regarding the sacrum, have 5 fused vertebrae. Sacral nerve passes through the sacral hiatus. Regarding sacrum, dural sheath terminates at the second piece of the sacrum. Regarding sacrum, the dimple is seen posteriorly above the buttock in the human body, determining the level of the sacroiliac joint. Nervous compression at which the following site causes decrease in corneal sensation: cavernous sinus, apex of petrous temporal bone. Infection at which the following location could give rise to enlarged submandibular lymph nodes: medial palpebral fissure, upper lip, upper central incisor. Sympathetic nerve supply to the lacrimal gland travels through the following nerve: deep petrosal nerve, maxillary nerve, zygomatic-temporal nerve. Superior cervical ganglion, internal carotid plexus, deep petrosal nerve, median nerve, pterygopalatine ganglion, maxillary nerve, zygomatic branch, zygomatic-temporal nerve, lacrimal gland. Masseter attacks the zygomatic arch. Right glossopharyngeal nerve damage resulted in loss of bitter sensation of posterior 1/3 of the tongue on the same side. Loss of gag reflex. In unilateral glossopharyngeal nerve damage, there will be no gag response when touching the pharyngeal wall on the same side of the damaged nerve. Impaired parotid gland secretion on the right side. Glossopharyngeal nerve damage resulting, which is the following arteries supply the tonsils: facial artery, lingual artery, maxillary artery, ascending pharyngeal branch of external carotid artery. Regarding the larynx, thyroaretinate muscle alters the tension of vocal cords. Regarding the larynx, in swallowing, the epiglottis acts as a passive valve. Larynx is parasympathetic innervation of the lacrimal gland travels through the following structure: pterygopalatine fossa, greater petrosal nerve, geniculate ganglion. Regarding the superior orbital fissure, it transmits the inferior ophthalmic vein. Inferior ophthalmic vein runs back to the drain through the inferior orbital fissure into the pterygoid plexus and either directly into the cavernous sinus through the superior orbital fissure or by joining the superior ophthalmic vein. Superior orbital fissure contains the lacrimal nerve. Its widest path is situated medially. Regarding the face, failure of fusion of maxillary processes resulting in cleft palate. Regarding face, malignancy of the skin in occipital area can spread to the upper deep cervical nodes. Buccinator and superior constrictor originate from the pterygomandibular raphe. All the muscles of the facial expression are supplied by the facial nerve. Regarding scalp, trauma to the scalp will not avulse the pericranium. Regarding scalp, supplied by the maxillary branch of the trigeminal nerve. Regarding the infratemporal fossa, deep temporalis fascia covers the temporalis muscle. Buccal nerve rises between two heads of lateral pterygoid. Regarding infratemporal fossa, middle meningeal artery rises through the foramen spinosum. Regarding infratemporal fossa, dental infection can spread to the infratemporal fossa. Infection of the infratemporal space is a rare clinical condition which occurs mostly due to the dental infection, tooth extraction, fracture involved in the maxillary sinus, and infection of the maxillary sinus. True false. Incudus-tapedic joint is a synovial joint. Regarding iron orbit, lamina pepracia is the thinnest part of the orbit. Lamina pepracia, the paper thin orbit plate of the ethmoidal bone. The lacrimal gland is derived from the surface ectoderm. There are no rods in the fovea in the eye of orbit. True or false? Interstitial layer of diffusion encloses the parotid gland. Carotid sheath contains the roots of the ansa cervicalis. Neural crest cell derivatives, contractile septum in heart, Schwann cell, adrenal medulla, dorsal root ganglion. Regarding nose, nasal septum is formed by the vomer and the perpendicular plate of the ethmoid bone. Vomer, inferior part of perpendicular plate of the ethmoid bone, superior part. Regarding the nose, it is supplied by the superior alveolar nerve. Lymph from the posterior part drains into the retropharyngeal nodes. Lymphatics of the nasal cavity drains to submandibular, retropharyngeal and deep cervical nodes. Regarding the nose, little area anastomosis is formed by the external and internal carotid arteries. Regarding the nose, its lobes free and lies the superior meatus into which drain into ethmoidal air cells. Which of the following sides of the facial nerve lesion causes its lateral dryness of the eye? Pons, nervus intermedius, geniculate ganglion, foramen lacerum. State whether following are true or false. Lesion in the right occipital lobe leads to defect in the left visual field. Left spinous trigeminal nucleus defect results in loss of pain and temperature sensation on the left side of the face. Right-sided upper motor neuron lesion of the hypoglossal. State or true or false in relation to the muscle action. When the eyeball is deviated medially, superior oblique action can depress the eyeball. Lateral pterygoid muscle is the only muscle of mastication, depressing the jaw, opening the mouth. Posterior cricoid is an abduct of the vocal cords. Medial pterygoid muscle has a minor contribution in protruding the mandible. Which of the following are derivatives of the postpharyngeal arch? Malleus, mandible, maxillary prominence, temporalis. Regarding ganglions associated with cervical nerves, the cell bodies of the chorda tympani lie in the submandibular ganglion. Ciliary ganglion is lateral to the optic nerve. Otic ganglion can be seen inferior to the foramen ovale. Ciliary ganglion transmits sympathetic fibers. Regarding cerebral cortex, social behavior is controlled by the frontal lobe. Cingulate gyrus is a component of the limbic system. Visual association area is Brodmann area 1920. Regarding scalp and face, the scalp is more numerous in sebaceous gland. Observance connects scalp veins with the superior sagittal sinus. Veins of the medial margin of the eyelid communicate with the cavernous sinus. Sepsis in the danger area of the face causes cavernous sinus thrombosis. The superficial temporal artery is palpable against the zygomatic arch. Opening of the rima glottis is produced by the posterior cricoarytenoid muscle. Regarding the cerebellum, lesion causes hypotonia. Intentional tremor is a feature of cerebellar disease. Pain fibers from the little finger are transmitted via the medial cord of the brachial plexus, M4U medial cord. Bitemporal hemianopia is seen. Aneurysm of the anterior communicating artery. The aneurysm arises superior to the chiasma, enlarge and compress it from above. Pituitary adenoma, compression of the optic chiasma as by a pituitary tumor. An ataxic patient sways back and forth when the eyes are closed. This persisted even with the open eyes. There is no vibration sensation loss in all four limbs. What are possible sites of the lesion? Cerebellum, the cerebellar peduncle. Regarding the scalp bleeding profusely is caused by the retraction of blood vessel by the deep fascia. Regarding scalp, extend from supraorbital margin and relate to the highest nuchal lines at the back of the skull and down to the ears and zygomatic arch at the sides. The arterial walls are attached to the dense connective tissue of the second layer of scalp and tend to be held open and bleed profusely when cut. The ends of the scalp have connection with dural venous sinuses. At the vertex, a parietal emissary vein on either side of the midline connects the scalp veins with the superior sagittal sinus. Regarding scalp, anterior scalp drain from the anterior half to the preauricular parotid nodes. Pair of supratrochlear, supraorbital, zygomatic-temporal, auriculotemporal, less occipital and greater occipital nerve. Thus 12 nerves in total. Regarding parotid gland, lies below the external acoustic meatus. Invested layer of deep fascia covers the parotid gland. Parotid gland is separated from the submandibular gland by the Stallhide ligament. Regarding parotid gland, apex overlaps the posterior belly of the digastric muscle. It overlaps the posterior belly of the digastric and the anterior border of the sternocleidomastoid. Parotid gland is a ectodermal derivative. Regarding the nose, nasal septum is formed by the worm and the perpendicular plate of the ethmoid. In the nose, G is a general somatic afference of trigeminal nerve. Regarding the nose, little area is the lower anterior part of the septum. Superior meatus receives the opening of the posterior ethmoidal air sinus. Regarding the nose, what are the contents of the posterior triangle of the next subclavian artery? Omohyoid muscle, 3 trunks of the brachial plexus and branches of the cervical plexus. The inferior belly of the omohyoid crosses the lower middle part of the triangle and is kept in place by its sling of investing fascia. The investing layer of deep fascia is attached to the following structures: superior nuchal line, hyoid bone, spine of the scapula, suprasternal notch. Pretracheal fascia attached to oblique line of thyroid cartilage. Regarding cranial nuclear tracts,